Hi guys, welcome back to Evolve, to another episode of Evolve. You told us that we did not give you a background on mental health, so we listened. We brought on this show Dr. Kevin Moracha, CEO, Nairobi Women's Hospital, Adams Arcade Unit. So Kevin, welcome to the show.
Yeah, thank you so much. Because I feel privileged to be here. Because Evolve Africa is a channel that I have been following for quite a while now. Both funny, humorous content that is there, yet very relevant. At the same time, I'm excited because mental illness is a topic that we, as a society, we have shied away from discussing. So I think it is going to create an impact to some of the viewers and also any other person who might come across this content on the YouTube channel.
Okay.
So thank you so much for having me.
We are so happy to have you. Thank you for coming. So the first question would be, what is the definition of mental health? What is mental health? How do you know you're mentally okay, you're not mentally okay?
All right, thank you so much for that question. That is a very good question. So about mental health, just to simplify, so that the general population is able to understand this topic, it is any disability in how someone behaves or thinks that is from the normal. Most of the time, we will classify someone to have a mental disorder if this is affecting the way they are functioning in their day-to-day activities. So basically, it is the way any deviation from the normal thought or behavior that is affecting how you are functioning on a day-to-day basis. Okay. Yes.
So what are those telltale signs that you're not mentally okay, and you should seek help?
So mental illness affects quite a number of systems in the body. And symptoms are not very specific for mental illness, but maybe some symptoms that or signs that you need to be on the look as a person or as a relative of someone who is suffering from mental illness is withdrawal. Withdrawal is very common. You would see someone who previously was associating with people so much. Nowadays, they fail to do so. They are not finding fun in activities that they used to find fun in. Others is eating habits. So someone who previously had a very high or low appetite, behaving vice versa. Sleeping patterns is also another major sign or symptom that comes with mental illness. So it could be the other way or reverse of it, from someone sleeping excessively or lacking sleep. The other one is suicidal thoughts. So ranging from wanting to, to kill oneself to a defined method of going to action it or even an attempt. We would also have symptoms like substance use. So people who were social drinkers, social smokers, or even not using any illicit drugs, now getting themselves into a lot of drug use or abuse. So that could be a sign. And now moving to the specific symptoms of other illnesses, they would be having what we call hallucinations. And this hallucination means that someone is hearing voices that other people are not hearing, or even seeing things that other people are not seeing, or even feeling on the body sensations that are not actually existing. Others would talk a lot. So someone would talk and not able to be stopped when you are engaging them in a discussion. Other symptoms could also be, people who are grandiose. That is, they imagine very, very big ideas. A case example is some of them would be thinking that they speak directly to God, or God feels like they are more special than the rest of the human beings, or someone who doesn't actually have property and they can come to you and tell you the way they own 15,000 acres of land in the US. So those are grandiose thoughts, and many, many others. But those ones that I have elaborated are the main common ones that you also need to, to watch out on yourself or on people that are affected by mental illness.
So when we talk about mental illness, I think there's a lot of stigma to it because people think of the extreme of the person who is out there unclean, collecting papers. But does it vary, or are there stages, or can you be mentally ill and yet you're performing like any other person in the society?
That is a very good question, Esther. Mental illness is very common, I would say so, than what we think. And so many people that we work with, we go to school with, and we interact with on a daily basis might be suffering from mental illness. And of course, from our society, there is a lot of stigma that comes with mental illness. And it is because previously we always thought mental illness is, it has an association with witchcraft, or, dirty people, or, people who are there sleeping in the streets and, collecting garbage. So there is that association, which as doctors, we are trying so hard to break. And of course, these are human beings. And just like someone who has a common ailment, like a common flu, mental illness is just a common disorder like that. It is just affecting what you are not able to see. And of course, with proper medication, or depending on the level of their illness, there are people who can operate normally, go to work, operate machinery, drive, and carry out the activities that any other normal person would carry out. Yes.
So mentally ill people are not necessarily violent. They can
Not
become.
really.
So that's a myth.
Actually, because this is illness of how someone behaves and how someone thinks. Most of their actions are very innocent. So if you find someone who has mental illness and they are violent, it is because probably they are seeing people who want to attack them, and these people actually do not exist in that environment. So they would see you, and in their minds they think this is that person who was bad. So that is the reason why they behave the way they behave. But again, with treatment, you are able now to control those, what we call hallucinations, and they become fewer, or they disappear completely, and you are able to. And we also have an array of mental illness, many, including sleeping and eating disorders, anxiety, panic attacks. Also, those ones are mental illnesses. We have bipolar, we have schizophrenia. They're quite a lot. Not all of them present in a similar fashion. So depending on what you're suffering from, then you present differently. But not necessarily that everyone who has a mental ailment is violent. Actually, a very, very small number do have violence or present with violence.
Okay. So I spot these symptoms in a loved one or in myself. So where do I seek help, and how much is it?
So the way our healthcare system is structured in Kenya or in Africa majorly is a primary healthcare system. So what does this mean? It means that, first of all, you just need to go to the nearest healthcare facility. From there, you will meet healthcare practitioners, a clinician or a medical officer, who will then filter you and refer you to a higher level. So for me, what I would advise as a healthcare practitioner is that once you suspect that yourself or your loved one is suffering from mental ailment, just go to the nearest healthcare facility. And from there, definitely you will either receive treatment, or this can be escalated now to a higher level. And by a higher level, we have different cadres. We have psychologists, psychiatrists, therapists, that is psychotherapist, who will now attend to you depending on what you require. So treatment can be, can be even psychotherapy. It can be behavioral therapy. It can be medication. So what once you arrive at the doctor, then it begins by a doctor taking a good history, either from yourself or from your relatives, because sometimes, we have patients who do not have insight. And once a good history has been taken, then a physical exam is done. In mental health, we call it an MSE, that is mental state examination. So it is a bit different from what we normally have on these common patients. So a set of questions and also observation on how you are answering them or behaving during an interview. From here, the doctor might also do a few tests and imaging just to rule out some other causes of presentation, like someone who has a mental ailment. And from there, then treatment, the relevant treatment is initiated for you. Yeah.
So that sounds expensive with the terms psychotherapist, behavioral therapist. So there is a person there who even the basic needs, it's a problem. So does it mean they can't seek medical assistance? Is that the way the healthcare sector has been structured to assist?
Actually, the problem with medicine is that we have a lot of jargon, eh? And sometimes as doctors, we cannot differentiate whether we are talking to the layman or a fellow doctor or medical practitioner. So sometimes we forget. But all I can say, as much as these words are big words, psychotherapy, cognitive behavioral therapy, these are just names that we have given to different forms of treatment. This is achievable. It is actually very cheap. Initially, even the government itself had set up ways to, to harass even the people who had mental ailment. But we now have a mental health act in parliament that was created. And of course, several hospitals that offer mental health treatment, like Mathare Hospital. And actually, I can say I'm very confident that, any public hospital, they have, psychotherapists, they have psychiatrists now, and even those therapists are actually available. And even treatment for mental ailment, the drugs are quite cheap. They are provided by the government. So it depends with your pocket also. If you feel like you need private healthcare or public healthcare, it is available. But what I can say, it is treatment is widely accessible.
Is it covered by the insurance covers?
It is actually. NHIF covers that. And even these private insurances have now embraced, most of them have embraced mental health, and it is being covered. So I would say no one should be afraid to seek medical treatment. It is widely available, it is affordable and accessible.
Okay. So when we think of mental health, we normally think from the neck up. Does it affect the other parts of the body as well?
Yes, it does. And maybe if I go back to the causes of mental illness, first of all is genetics. So genetics play a very big role. And you see, when you are being born, you have genes of your mom and your dad. And you cannot say that the genes will only be on the head up. The genes are widely distributed to any part of the body. Secondly is exposure to the environment. So what you have gone through in life, it could be life experiences like financial instability, it could be stress in your relationship or marriage, it could be job loss, it could be also work stress. So all that, you can see it affects the whole body. We also have a theory where, as doctors, we are thinking of something called neurotransmitter. This is, in a layman's language, I would say a hormone. So these hormones, sometimes when they are in excess or reduced, they can present with they can cause mental ailments. So as you can see, when a hormone is released to the body, it is released everywhere. It gets into the bloodstream, and you know that blood travels across every part of the body. And because of that, mental ailment affects almost any system, because you see, even someone who has mental illness, they might fail to eat because of the state in which they are in. And during this moment now, they might present with malnutrition. They are not taking care of themselves. They might get sick. They might catch illnesses as they are drinking that water from a trench. And also, it is affecting, maybe someone has a panic disorder. The whole body is shaking, they're shivering, they're panicky, they're having palpitations, or the heart is racing. So it does affect the overall human being. And because of this, when we are talking about the definition of a normal person or a healthy person, using the World Health Organization standards, we also include the mental aspect. So we talk about, of course, the bodily aspect and the mental aspect. So that one was included because it is affecting other systems. And again, it affects the overall health of a human being.
When now you spot these symptoms in a loved ones, and how do you approach them? Because there's a lot of stigma with mental health. So how do you approach them so that they take it positively and they are able to seek for help?
So that is a very important point you have, or question you have brought across. And I'm really happy because one of the main pillars of treatment is social support for people with mental ailment. And this plays, I would say, like 80% of what the doctor is going to do. So the first thing is to show them love, because as we know, mental ailment, there is a lot of stigma that comes with it. So the first thing is for you to accept them. So accept them and show love to them. That is the first thing. Most of the affected individuals also would lack insight, and insight is that they would think they are okay. So as much as they are doing what they are doing, they think that that is just okay. So it is bringing an insight to them that, you need medical attention. You see, there are some things that are happening that we have noticed as a family or as a friend or as friends that we are concerned about, and talk them into seeking medical treatment. So I would say it is a process. It is not an event. So you really have to interact with these people and show them that you love them and you're ready to help. Beyond that, there is, of course, the financial aspect, because people with mental ailments, they would visit hospitals so regularly. So some of them would, in the initial stages, probably weekly. In the initial stages, we might need to admit some of them. And then later on, we have medication that we give them to take on a daily basis. And again, they have to come to the hospital depending on how they are doing, on a monthly basis or a 2-month or quarterly or even biannually. So there is a lot of social support that is required. Of course, now even their functionality might be affected. Before the treatment kicks in, then you might need to even take care of their bodies in terms of cleanliness and taking them to a barber or a salon, food, clothing, and also other issues like, taking care of their basic needs, because they might not be functional well enough to go to work or, perform their normal duties. Yes, so
the other question is, can a mentally ill person hurt others? And also you said one of the symptoms is suicidal thoughts, and suicide is on the rise at this particular moment. So how seriously should we take the threat for suicide? And what are the chances of a person suffering from mental illness committing suicide? And why suicide? Does it rush from to, like, you just want to commit suicide?
All right, so suicide, it is a red flag, I would say. Once someone mentions suicide, then you need to be worried. Whether it is something to, mentioned casually, or someone has mentioned it with a lot of seriousness. So suicide, you better be safe than sorry. So I'd rather intervene to someone who says that they want to commit suicide and they were not serious, than they mention it in a casual way, and I keep quiet, and then later on something bad happens. So let us all be very serious when, let's take it with the seriousness it deserves, especially when someone has an idea of taking their own life. And it is very common, mental illness. We might not be thinking how common it is, but there is a survey that was done in the US 2 years ago, that is in 2020. And imagine 20% of the population had mental ailment. So that means if we are in this room, 5 of us, 1 person has a mental illness. So that is how common it is. Unfortunately, in Africa, I think I would say we have many other problems. We, as doctors, we don't do a lot of research, although it has been done. But that is a research I came across when I was doing some reading. And, that is a very common. And unlike in the past, we used to think mental ailment is affecting only adults. Nowadays, teenagers are being affected at a very alarming rate. And that is from the age of 15 to about 29. That is the youth. And you see, even looking at suicide within that age group, it is among the leading causes of death in that age population. So you can see how rampant it is. You've seen in the media, people taking on life, people going and shooting innocent children in school, or even families, even right back here at home. You've seen someone taking the life of the wife, the children, and also self. They commit suicide. It is because of mental illness, because a normal person wouldn't, a person who does not suffer from mental ailment would not, think or imagine of doing such an act.
So is there a difference between being mentally ill and it's just your personality? Like you're just a difficult person to deal with?
All right. I'm surprised, because that is a very good question. I would expect it from a doctor or a nurse, someone who works in a hospital setup. It is very difficult, for people out here or the general public to differentiate between a mentally unstable person or a personality. So what exists is that we do have mental illness and we have personality. So mental illness, I have already defined it as the way you think or behave. And personality, you see, personality from the word personal, it is who you are. So we also have personality disorder, and there is a borderline. So in this borderline, we have acceptable behavior. Even in mental ailment, you cannot just shout like this and then we brand you and say, oh, so-and-so is, this guy is mad. No, there is a criterion. Yeah. And what we are using right now is a criterion used as, it's called DSM, and there are other criterions that we use. So we have indicators where we score someone. So we'd look at the period and some symptoms. So once you score highly on that criterion, then we say, this person might be unwell. Also, when it comes to personality disorders, there is an acceptable range of how, you have a personality. And we'll also use the DSM to classify you and say, now this one is maybe a narcissist person, or this one, we will classify you according. It's wide range of personality disorders. If we have time, maybe we can talk about it later on, because I also believe that this is one of the topics that it has not been explored well, yet we have a lot of people who are affected by this.
Is there a cure? Once now you found you have a mental illness, is it? Do you have to take medication all your life? Will you improve? Or you have a personality disorder, as you termed it? Is there a cure?
Cure depends on cause. So if I'm having mental ailment because of an organic cause, And by that I mean, something that is inside my body. If we modify that factor and remove it, then someone is okay. We still have some mental ailments that require behavioral modification. So depending on the level, someone can have a cognitive behavior therapy, which will modify them to be normal or near normal. Also for treatment, there is treatment that can stabilize your mood. So cases like bipolar disorder, it is a disorder of mood. You're having two extremes, bipolar, so one pole and the other pole, which are quite opposite. So we have mood stabilizing treatments, which put you at level where you are supposed to. And, they control what I called initially neurotransmitters. So that one, it depends with the level where the patient is. And we have patients who can recover well. We have patients who can recover and later on they have a relapse. We have patients who will be on treatment for their own, throughout their own life, the whole life. And we can also have patients who have a bad outcome. You are treating them, yet they are just deteriorating. They are going down, down, down. Like especially that one we see in patients who have schizophrenia, which is a certain type of mental illness.
Can mental illness kill you?
I would say yes and no. Yes, because of what it causes. So complications of mental ailments can lead to death, or because you clearly see that when you have a mental ailment, then you can kill yourself. You can even be crossing on the road and a vehicle hits you or a train. You could die out of other causes like malnutrition, other ailments. And no, because it does not directly cause death. It is the complications that come around with it.
Okay. So why is it so important for us to take care of our mental health?
It is because we are human beings and we function on a day-to-day basis. We carry out activities. Since morning, you've done so much. You prepared yourself. You thought about some decisions to make, which are important in your life. They, even touch on expenditure. They touch on even people around you. So when you have mental ailments, then, you are not able to function well. So meaning that you are in a certain space where you are trying to achieve some of your goals and objectives and you are not able to. So it is very important because it affects us on a day-to-day activity that you are planning to do. Yeah, so it is very important because again, we need to enjoy life. Life is short, so you need to interact with people well. You need to make good life decisions because they are going to affect you and even the people that you are going to leave behind. Yeah, so quite important.
Yeah. And finally, I'm wondering, you're a doctor, so you have all this information. Do doctors, nurses, psychiatrists, therapists suffer from mental illness as well? Or does it just affect the people with no information about it?
Yes, we do.
Yeah.
And you remember the causes of mental illness? I talked about genes. So, genes don't select someone, whether you are a doctor, engineer, whether you are someone of a low class. Genes are genes. And by genes, what I mean is that if someone in your family, a close relative, maybe your auntie, your uncle, your parents, or your brother or sister, or even your grandparents, suffered from mental ailments, you are likely to suffer. So that is number one. So that one is not a modifiable risk because we do not choose where we come from. And then now we have the modifiable factors like what we are exposed to in life. And doctors are not an exception, or other healthcare providers. Why? Because they go through stress. We actually see a lot of patients and, even the staffing that we are having in our hospital setups. We are seeing quite a number of patients. So we are stressed with work. We are also people who make bad decisions, like because of little money that we earn as salary, we might decide to go and drink. So I'll drink today, tomorrow, and the other day, and try to try out a certain drug and everything. So I'll find myself, getting myself into that. There is also the aspect of work stress. Apart from the huge work amount that we are dealing with, we're also dealing with people's problems on a daily basis. So today, we get very few happy news, from our patients. I can make a joke of it. You will save a mother who's giving birth on the road and do something. Once they give birth, you know what they say? Thank God. What about the doctor? The doctor. So we rarely receive compliments. It is on a daily basis. It is just work, work, work. People are bringing problems to you.
Yeah.
At the end of the day, you have seen people dying in your hands. You have seen bad outcomes. And of course, that can affect you because you've handled a lot of trauma cases. Probably you had even bonded with your patients while you've had them in ICU for a month. You saw them coming up and then bam, they've gone and you've lost them. So we do have stress. And unfortunately, by the way, that is we are really having alarming numbers, especially for people who work in hospitals compared to the general public. Of course, you've seen in the media, we have doctors who have killed themselves. They have killed their families. We have doctors who, have done very crazy things.
Is there a platform that offers support for doctors?
For now, the platform is, the activity is very minimal, but I know of some doctors who have come out to support their fellow doctors. So it is something that is coming up. Also mental illness is not something that we have really put focus in. But I'm glad because there's some activity. It's minimal, but, it's coming up. Yeah.
Thank you so much. Is there any parting shot or something you feel maybe probably we should have covered and we didn't?
What I might, what I will wind up saying is that health is very important. Health, focus on the physical well-being and the mental well-being of yourself or your loved ones. And let us take care of, let us give people with mental illness the support that they deserve. Because you don't know whether it will be you or your brother or any other person. So basically, let us be brothers keepers. Let us stop this stigma that we are showing people with mental ailment. Mental illness is just illness like any other disease. It is, compare it with diabetes. Do we show any stigma to diabetics or people with hypertension? No. We see them and we love them as the people who are just having a common ailment. So let us embrace and love them, show them the support. Let us stop the stigma, and we'll make this world a happy place to live in. Yeah, for all of us.
It's so beautifully said. And thank you so much for coming. That was such a beautiful conversation, and I feel like it has shed a lot of light because we were just doing videos and people didn't understand the background of it. So it was such a pleasure having you in the show.
Thank you so much, Esther. For me, it was a privilege to be on such a channel. And all I can say is that you are really doing a good job. So keep it up. In case there is anyone watching, please subscribe and also hit that notification bell.
Oh, thank you
and
so much.
There is very nice content in that channel. Thank you so much for having me on the show.
Thank you. If you guys would like to reach Dr. Kelvin Moracha, you can find him, as we said, he's the CEO of Adams Arcade, Nairobi Women's Adams Arcade Unit. So that's it. Continue giving us your feedback and any other areas that you'd like us to cover.
Bye-bye.
Bye.